Remember to subscribe, and hit the bell icon, to never miss an update from Dr. Mike Baby Care Channel.
Your pregnancy. Week 23. At 23 weeks, you might be surprised to know that your baby can hear your voice, thanks to recent ear development. Give her a daily treat by reading, talking, or singing to her. Your partner can also do the same. While having the nursery painted and stocked with diapers is important, there are some less fun to-dos you should have on your radar, namely financials. Week 23 of pregnancy is a good time to call your health insurance company to see how you're currently covered and decide what adjustments you'll need to make for baby. Consider writing a will if you don't have one, or updating your current one. Now is also a good time to start a savings account for your baby. Even making small deposits will help once you factor in the time value of money. The earlier you start saving, the faster your money will compound. One study found that kids who have their own savings account are more likely to go to college, and another one estimated the average cost of raising a baby until age 18 to be over $226,000. That's not a small amount. Your baby's development at 23 weeks. At 23 weeks, your baby is about the size of an eggplant. Your baby can now hear sounds from the outside world, although they're muffled by layers of skin, uterus, and amniotic fluid. Those little arms and legs are packing more of a punch these days. You might even see them poke through from the outside. The wave-like movements that propel food along the digestive tract, peristalsis, begin. As with swallowing, it's just practice for your baby's system at this point since there's no actual food to move. The lungs are producing surfactant, the substance that helps them stay inflated after a breath. 23 weeks pregnant symptoms. This week, you might be dealing with pregnancy symptoms such as food cravings, leg cramps, forgetfulness, Braxton Hicks contractions, or back pain. Some other symptoms would be swollen ankles and feet. Some puffiness is totally normal. Deal with it by putting your feet up as much as you can, taking regular walks and drinking lots of water. Call your doctor if you get extreme or sudden swelling, which can be a sign of a dangerous pregnancy complication called preeclampsia. Bleeding or swollen gums. You probably didn't expect pregnancy to affect your mouth. Pregnancy hormones increase your blood flow, making your gums more likely to swell and bleed. If your mouth is feeling more sensitive than usual, switch to a soft bristle toothbrush and continue flossing. Stick with your normal dental exam routine, seeing the dentist at least every 6 months. In fact, your dentist may want to do extra checks while you're pregnant. Skin discoloration. Believe it or not, it's called the dark line, or linea nigra. A common emblem of pregnancy that may be more noticeable in darker-skinned women, the linea nigra runs between your belly button and your pubic area. Rest assured, you won't be playing masquerade for much longer. All these skin changes will fade within a few months after delivery. In the meantime, bring on the concealer, though not the bleaching creams, which won't work anyway. Pregnancy checklist at 23 weeks pregnant. Get outside and enjoy the sun. Getting your vitamin D is important when you're pregnant. Plan for time off. It's a good time to finalize your maternity leave for after the baby is born. Check for your life insurance coverage. Is it in order? Create lasting memories by organizing a maternity photo shoot while you still have the energy. While your baby is still developing and not quite ready to join the world, it's now possible that the baby could survive outside the womb with highly specialized care. Each week that passes from now until birth gives your baby an even better chance of survival. Still, it's nice to know that only about 0.5% of babies are born before the 3rd trimester. Thank you for watching. Don't forget to subscribe.